So
Dr.
thank you, sir.
Neha, you can
Thank you,
start the session
thank
now.
you, Sahani sir, and thank you, Dr. Makkar, for the Hindi session.
Okay, thank you.
Yes.
Thank you.
So now we are moving on to our English session tonight. So good morning, good evening, and good afternoon to everybody present here in today's International English webinar session organized by IFPH. As everybody knows, IFPH organizes daily webinars in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have our international English session. And from 9:30 to 10:30, we have our local Malayalam session. So today is our 1731st day of uninterrupted daily webinar. And we'll start the session with the silent prayer. So the guest speaker for tonight's session is Professor Dr. AARTI Satish Kognole. Dr. AARTI, I welcome you into today's IFPA session. Welcome. Yeah. So I'll give us a short intro about Dr. AARTI. Dr. AARTI is MD and PGDHMS. She has been a rank holder and she has been a professor and a PG guide. Currently, she is the HOD and Vice Principal of Department of Repertory in Dr. J.J. Magdam Homeopathic Medical College, Jaisinghpur. She's also a consultant physician. She's practicing also at Ayush Homeopathic Clinic at Jaisinghpur, Kolhapur. And today's her topic of discussion is role of homeopathic repertory in acute diseases, whatever acute problems we are facing, how we can use our repertories in these cases. She'll be taking our session tonight. So Dr. AARTI, you can start your session now. Kindly unmute, ma'am. Yeah.
Yeah. So I will share my screen first of all.
Yeah,
Let me.
sure.
Please allow me to share.
Yeah, just a second. Yes, ma'am, you can do now.
Is this visible?
Yeah, your screen is visible, ma'am. Presentation.
Is this 1 minute?
Yeah.
Is the screen is visible?
Yeah, I guess this is your screen only. We're seeing that session screen here.
Yeah. So good evening, everyone. First of all, I would like to thank Dr. M.K. Sahani sir and Dr. Kakkar ma'am for giving me such a nice introduction. So on this, today is 1731st online session of International Forum organized by IFPH. So I'm very much thankful for giving me an opportunity to share my experiences related to the today's topic, that is role of homeopathic repertories in acute diseases. And also I'm thankful to Dhanish sir. So we'll start with the session. So my topic is role of homeopathic repertory in acute diseases. So the objective of this today's session is to understand the different types of acute diseases and to explore the role of repertory and its significance in acute diseases through demonstration of actual clinical cases. So we'll be having or we'll be I will be dealing with the 4 points, major points, that is introduction related to the acute disease, and in more highlight I will be dealing with the acute diseases, use of repertory in acute diseases, and lastly I'll be sharing few cases, clinical cases which have been seen by myself.
Dr. AARTI,
so this is, as we know,
presentation is not visible, ma'am.
Not visible?
No.
Just I will just stop the sharing once again. I will just I will start with myself. Share screen. Now is this visible?
Yes. Now is it? Yes.
Okay. So after maximizing, it has been reduced. So we will be dealing with 4 major points, that is introduction, then acute diseases, use of repertory, and clinical cases. Is it visible?
Yes, ma'am.
Ma'am?
Yes, ma'am.
Yeah. So, as we all of us know, that disease is being considered as a state of disharmonious functioning of vital force, which is being manifested by loss of sense of well-being. We have noted that organism is constantly required to adapt itself to its environmental conditions so that harmony is maintained. So, this process of adaptation can take place on account of susceptibility. In our clinical practice, we all of us know that we have to deal with acute and chronic cases, and it is observed that majority of the cases are seems to be in acute origin and rest are of in chronic origin. So the organism always tries to keep these disturbances away from the important organs, as we know that many of the acute illness they affect the organ on the physical plane, and like skin, muscles, bone, rectum, etc. So hence we should limit ourselves to the symptoms on that plane. So generally, on the superficial plane, these acute conditions they come on. So as we know that Hahnemann has defined the acute disease as the disease to which the man is liable to either rapid morbid process of abnormally deranged vital force, and which have a tendency to finish their course more or less quickly, but always in a moderate time.
Ma'am,
There may not. Huh?
kindly,
Yes.
just I'm sorry to interrupt you again. Kindly please expand your slides. You can start the slideshow.
Okay, okay. I thought after having the slideshow, it has been gone. So okay.
No, it will be, yeah, ma'am, because the screen becomes visible. That's the only thing. Yeah,
Yeah.
thank you.
Now.
Yeah, it's okay.
Okay. Thank you very much. So there may not be any unusual or strong symptoms in acute case, yet we can cure it by considering some common symptoms. As in many of the acute cases, we see that the characteristic symptoms are lacking, but we should not leave those acute disease without prescription. As William Borick, he has said that often the course of acute disease and in children, if there are no characteristics symptoms have been obtained, a pathological correspondence can help in dealing with the acute diseases. Acute diseases, they are more challenging to each homeopath because here the prescription should be most accurate to relieve the acute suffering of the patient. Otherwise, the case becomes more worse, suffers much, and the patient may leave the physician. Usually, acute disease present to us with distinct characteristic form, which suggests the acute remedy. In order to treat as early as possible, acute cases becomes the prime need of the physician. If we go through our literature also, we will find that our masters they could cure serious acute cases like cholera, pneumonia, typhoid, plague, etc. with potentized remedies. Acute diseases are well represented in our repertories. We can construct the acute totality with repertories to reach the minimum. Even modern repertories and computer repertories, they have made our task easy so that the case can be repertorized for even in acute cases. Majority of the physician they feel that ki baba, in acute cases repertorization is not essential, but I feel as far as my experience is concerned, for acute cases also we need to have the repertorization process. Even though the acute elements the particular dominates the picture, there are various repertories where the particulars they have been well explained, like Boga Boni Hussein's characteristic repertory, and TPB. All these repertories where the particulars can be seen, even in Kent's repertory, we the acute elements as well as the chronic cases they can be repertorized well. Even after the even we see certain cases where the acute exacerbation of chronic state are seen, and these should not be however missed for the acute illness. The management of the remedy in regard to the potency and the dose is also very as important as the process of remedy selection. So this was the part of the introduction, some section, and we'll be shifting to the acute disease. As we know that in organ of medicine aphorism number 72, acute disease has been defined as the rapid morbid process of abnormally deranged vital force which have to tendency to finish their course more or less quickly, but always in a moderate time, which have the prodromal period, a period of progress, a period of decline, and if not severe as to cause the patient's death. So acute disease they lead to recovery or death, which is produced by an exciting cause or an acute miasm. Thus, acute affections can be divided, according to Hahnemann, into two classes: those that are miasmatic, which are the true diseases, And this acute miasm has a distinct course to run, like for example, measles, scarlet fever, whooping cough, etc. These can be categorized under the acute miasms, whereas those that may be called as mimicking sickness or maybe related to the indisposition, like living in damp houses, grief, bad clothing, etc., which causes being latter. If there are no definite causes, they have been produced by certain external causes, and if there's those have been removed, the patient gets cured. So, as we know that in acute disease, it is possible that the remedy may change very soon, followed either by the patient may get cured, or they do not require another medicine, or it will come back, or it will shift on to the chronic totality. One of our greatest clinician, Dr. E. A. Farrington, he has said that the treatment of cold is a severe test of skill of a physician. If you can successfully treat them, you must understand the homeopathy well. So many of the physicians, they have a lack of confidence in treating the acute diseases. But if we see that in our literature, many of the our stalwarts, they have gained the fame because of treating these acute diseases. So acute complaints, they, even though they present with the kaleidoscopic combinations of the symptom, one has to make a lot of comparison, so to arrive at at a one single remedy. Even in acute cases, pathological changes in acute cases are more inflammatory and reversible in character, so that complete recovery is possible. In acute disease, the disorder is located in lower scale of life. We should concentrate, as I told you earlier, on more on particular symptoms. Many seemingly acute conditions are not true diseases but mere indisposition, which disappear by themselves under ordinary circumstances, and the when cause is removed or yield easily to the corrective hygienic condition or dietary measures, if they have been corrected, or certain mechanical injuries, mechanical measures they have been introduced, these acute complaints can be disappeared. So, as regards to the classification of the acute disease, as we know that there are three types of acute diseases. One is the acute individual acute disease, sporadic acute disease, and epidemic diseases, which has been introduced in aphorism number 73 of Organ of Medicine by Dr. Samuel Hahnemann. So, individual acute disease is that which attacks the single human being. They are the transient, nothing but the transient explosion of latent sora, and which is being caused due to exciting factors, like it may be due to excess or insufficient supply of food, or any severe kind of physical impression like chill, overeating, dissipation, strains, emotions, etc. Whereas sporadic acute disease is that which attacks several persons at the same time, here and there sporadically. Here, the exciting factors are meteoric or telluric influences, and in epidemic diseases, which attacks many persons with similar suffering from the same cause. And this disease is due to some general climatic conditions like war, famine, overpowering the resistance of the mass of the people in some locality, or due to infections. If you see about the case taking procedure in acute disease, which has been explained in 19, aphorism number 99, as actual, it is very easy to take case in acute diseases, because all the phenomenon and deviations from the state of health that has been recently lost are still in the memory of the patients and the relatives. So the clear cut picture of the totality, which has been said, or which has been given by the patient, can be can be narrated by the patient as well as, and can be received by the physician. The physician certainly requires to know everything, but much less to inquire into in case of during the case taking of acute disease. Presenting complaints are very prominent and impress our sense of quickly. So it requires only few questioning. Almost everything is self-evident in acute cases. So this can be described in four components like location, sensation, modalities, and concomitants. Generally, we take various camps in that various types of diseases that we come across at that time. When there is lack of time, at that time we can have this location, sensation, modalities, and concomitants for collating the totality of acute case. Whereas if I have got little bit time, where the history taking can be also done to know to achieve this simillimum, one has to go through the causative factor for the as in history of acute cases we have seen that these acute diseases are the explosion of the latent sora, so we have to certainly ascertain it. Acute diseases are caused by exciting causes or acute myasm. So, while attending the case, the physician should inquire to the recent deviation from the health since the acute disease require immediate medical intervention. One should not waste time in collecting the details as of a constitutional state. And therefore, in acute disease, the physician should be able to collect two main important aspect of the case apart from the location, sensation, modalities, and concomitant. That is the features at the general level, that is changes on the physical plane like appetite, thirst, thermal reaction, and respiration. Changes on the mental plane like irritability, confusion, fear, restlessness has to be also uh, collected. So, while forming the acute totality, it has been said that the totality of the symptoms changes more rapidly in acute conditions. So, much of this investigation is necessarily dispensed with. The physician recognizes the symptomatology and the case is being quickly disposed of. The totality of the acute disease is very simpler. It has only two components like sector totality and fixed general totality. In sector totality, as I've mentioned earlier, where the location, sensation, modalities, including causation and concomitant. So we have to elicit uh, these four major components along with the causation and concomitants while forming the totality in acute disease. Along with that, the fixed general totality of the general features, which I told you earlier in earlier slides, were the changes of at the physical plane in relation to the appetite, thirst, sleep, and thermal reaction. If we are getting this characteristic symptom under this plane, we have to record in our case taking procedure. So even if there is a changes in the mental plane, those characteristic mental symptoms has to be also taken into account in the totality, acute totality for consideration. So this sector totality is in between these two, that is sector totality and fixed totality. Sector totality is almost fast changing. That is presenting complaints, they have been changing. So the fixed totality, which is a general totality, has to be comparatively fixed. So in many cases, we see that in acute disease condition, a keynote symptom prescription is being done by many of the physicians. But I feel that the this general totality or general fixed general totality has to be also included if it is present in a case. So unless and until we try to elicit this general totality, we try to glean this totality from the patient. If we ask the question and if there is availability of such characteristic symptom, we have to take into account into the acute totality. So, in short and in brief, if we can say that formation of acute totality can be done in the following way, where the exciting or mentally cause, if it is present in a case, we have to mention it or we have to take it into the repertorial totality along with the locations, sensations, and complaints, modalities, and concomitant. So this is all about the acute totality. Many a times, various diseases we come across. So fever totality, which we see that Boger has explained this fever totality very nicely. We have this BBC repertory where the various fever cases can be repertorized and we can arrive towards the symptom. I've seen that many of the students as well as many of the practitioners, they feel lack of confidence in dealing with the fever cases. When there is a case of a fever, they little bit they are not taking homeopathically the case, but they just refer the case and they are just dealing with the chronic cases. But I feel that I always addressing to them that our stalwarts, they have various contributions in relation to the fever totality like Boger, Boningus, and W.A. Allen. So we have lots of the repertories where the fever has been explained well. So by utilizing those repertories, we can repertorize the case and we can arrive towards the totality. So in this fever totality, generally we see that three distincts, while how to take the history in acute conditions where the fever is there, where here the stages of chill, heat, and fever has to be elicited. We should also pay attention to the compound fever. Compound fever is nothing but the alteration in the stages of fever, generally we have first chill, heat, and sweat. If there is an alteration where there is no chill, direct heat and sweat, where heat is first and then chill and this sweat. So if such kind of compound alteration in the stages of fever is there, so even we can utilize the repertory properly and we can arrive to the most similar remedy. So these all minor things has to be noted into the case taking procedure of acute disease conditions. So along with that, we have to also try to find out the cause. The modality comes all at all the totality, where it may be a fever totality or it may be a disease where there is acute exacerbation, having a chronic disease having the acute exacerbation. So all modalities is one of the key factor in selecting the simillimum, so which unlocks the case. So modality is one thing where it unlocks the two similar remedies. It has been said by Boning Hussain. And even the characteristic symptoms we have to elicit whenever the case is of a fever, and concomitants, if it is there along with the fever condition, it may be the loss of appetite, it may be any kind of cough or cold and coryza, all those has to be noted in relation to the fever totality. Whereas coming next to the next point, that is formation of totality in an acute exacerbation of chronic diseases. We very often come across to the patients where in a chronic ill health, they have been coming down with, they are coming up with some acute trouble. It is quite essential that the homeopathic physician makes a clear distinction between the symptomatology of chronic ill health. Here, the acute illness will have to be treated on the basis of acute symptomatology, as I've been shared in the previous slides, whereas the chronic symptomatology come in handy when the selecting will come in handy if we want while selecting the deep acting constitutional remedy. So, thus, we come across to the acute prescribing, that is in acute miasms, generally genus epidemicus, can be acted as a curative and prophylactic, whereas in acute exacerbation of a chronic disease, acute prescription based on presenting totality is to be given more important than indicated constitutional remedy at the end of the acute phase, which prevents the relapses. So I'll be showing you various cases of acute exacerbation of chronic disease where these sentences, they really prove to be the true these sentences, they are really true when we come across to the various cases. But it has to be repertorized properly. So thus the remedy should be chosen by location, sensation, modalities, and concomitants, which is one of the active layer in acute conditions. We have to consider along with this the objective symptoms. They also to be has to be considered if they are present in an acute conditions. And generally we see in very acute diseases objective symptoms have been seen. Pathological types, location, etc. can be used as an eliminating symptom also, because here the repertorization we need the simillimum in a very fast manner. So if there is a characteristic symptom, then that symptom can be taken into as a account for eliminating rubric, and repertorization can be done accordingly to arrive towards the simillimum. The remedy chosen should be more superficial so that it will not disturb the chronic condition, and it will calm the symptom immediately without acting too deeply in the case. So generally in acute cases, we generally choose acute remedy. It becomes a complementary remedy to the constitutional remedy that follows. In many cases, I have seen many cases, if the acute remedy, if for example, I have prescribed for migraine, I have prescribed gelsemium, and later on, the same case, a constitutional remedy has worked very well in the same case, like argentum nitricum. So, acute condition has to be treated with the acute remedy, and that remedy has to be a complementary with the further constitutional remedy of the same case. So there are many in apart from the these cases, there are unusual prescribing, or in a very rare occasions in acute cases we generally follow the path of prescribing where there is an absence of clear pointers of acute prescribing. So here a nosode can be used, also can be helpful in acute conditions. Also the certain organ remedies may also help us for prescription in acute prescription. Even there are various physicians where pathological prescribing, they have cured many of the acute conditions. And By utilizing the alteration of the remedies, the acute conditions, they have been also treated well. So apart from these acute miasms and acute exacerbation of chronic diseases and other epidemic diseases, sporadic diseases, so even though there are certain things which we should not forget, that is toxicity. Nowadays, in this era, in this decade, where these cases they come across, so there are very good number of the rubrics in the repertory. Like even in cancer repertory, in generality section, we find various rubrics in relation to the toxicity. So there are various toxins, and those toxins they lead the patient to come across with the acute diseases. So like bacteria, viruses, fungi, and certain emotional stress, excessive emotional stress, hereditary or genetic toxicity, and chemical toxicity. So it requires, so this toxicity has got a, a certain good number of the slides, but as our topic is related to the acute disease, so we will be limiting to the acute cases only. But this toxicity has to be also taken into account whenever the acute conditions, acute diseases they come, whether the case is of toxicity, we have to think of even the deficiency. Because of certain deficiency, we have come across, I've seen many of the patients who deal with the recurrence of the acute conditions. So if there is underlying any kind of deficiency of nutrients, deficiency of water, deficiency of excess or lack of exercise, lack of rest, and lack of love, so all these conditions in toto, also at the backhand also we have to take into account. We should not forget that is there any kind of deficiency while dealing with the acute conditions. So this was all about a brief brief introduction to the acute diseases. Now, how this in acute cases the repertory is helpful, as we all of us know that homeopathic repertory is very indispensable tool in clinical practice, and it is helpful in selection of the and individualizing the simillimum. So the same thing in acute conditions also, this repertory is very much helpful along with the chronic cases. As we all of us know that the purpose of repertory is to find out the right remedy at the for a given case. uh, Master your repertory, it is always said that master your repertory if you want to master the art of case taking. I generally feel that the students or the physicians who read the repertory, obviously their art of case taking it will increase. And as we always say that our master said, the well taken case is a half cured. So if you are mastering your repertory, obviously one good advantage is that your art of case taking it enhances or it gets amplified, and out of which the correct totality we are able to arrive at, and obviously we come across to the most similar remedy. So repertory also help the practitioner to find out the small and rarely used remedies and to link unusual symptoms with the appropriate remedy. I'll be dealing with various cases as to how this repertory has helped me to come across to the unusual remedies which I had never ever thought of. So generally, if we speak about the use of repertory in acute disease, we can I can say that it's the habit of many of us to prescribe one or two prominent or on a keynote symptom, as I've told you in earlier. It is essential that to prescribe on keynote symptom, but I feel that in initial phases, true totality or correct totality, apart from the partial totality, whole totality has to be included. After continuous practicing, we may arrive to the simillimum by considering one or two prominent symptoms. But a good acute totality and repertorization always generally is very much helpful in to prescribe effectively. Our user friendly repertories, they follow the anatomical alphabetical schema. So if we are good or well versed in the case taking and we are correct in our case taking procedure, we can arrive to the correct acute totality. Many clinical practice, as I have told earlier, that many of the acute conditions where the repertory can be utilized on the pathological conditions. So various clinical repertories they help, they come to the aid in getting the two getting towards the right minimum. So many clinical repertories, they follow the region wise or clinical condition wise. We say we can come across to the Boric's repertory, Murphy's repertory, and even Fartek's repertory are the good clinical repertories. I have many cases. I have been utilizing these repertories as being a repertory teacher. So it is one of the good for me that I always go for various repertories. I'm not stick up with one single repertory. So one should be well versed with the utilization or adaptability or disadvantages of the repertories also. So a right repertory can be utilized for a right case. So if we use them effectively, obviously we should have a good knowledge of the basic construction and adaptation. Majority of the acute clinical condition we come across are well represented in our repertories. Many modern repertories, they are putting their best efforts to represent them as like synthesis repertory and complete repertory. So where all acute cases as well as chronic cases, all types of the rubrics, they have been incorporated. And nowadays the computer softwares programs, they have made our task much more lesser. So these are the use of acute disease. So just we in short we can memorize that repertory helps us to find out the complete symptom, which is one of the most essential part of arriving towards the acute totality. Location, sensation, modalities, and concomitants, they have been well represented in the repertories. For acute prescribing, which is more essential, thus repertory is helpful in acute prescribing. So even though if we are in a dilemma in choosing one or choosing two close running remedies, repertory can be helpful as a reference book. Even though you feel that the case doesn't require the repertory use of repertory, where the clear cut picture of the case determines the one single remedy, even though we can use it utilize repertory as a reference book. Obviously, for second prescription, many a times in acute totality, generally we give, we are not changing the remedies too fast. But in acute exacerbation of chronic diseases, where a little bit a change of the remedy is required, here for second prescription, repertory is very much helpful. It helps as an aid in the study of the Matra Medica, and it enriches the art of case taking, and obviously helps in the memorizing the Matra Medica. So these are the various usefulness or essence of repertory in forming the acute totality, as I have been just uh, told in the previous slide. So one thing of the scope of repertory is that a scientific aspect of homeopathy, as nowadays all the cases needs the evidence based homeopathy is now been flourishing up. It's not the era now ki baba we have treated the case and just explaining the case, but there should be certain evidence based, and where repertorization or the process of repertorization is one of the scientific aspect to prove that how these remedies we have, how we have arrived towards um the particular remedy or a simillimum. So for all scientific researchers, for PhD scholars, or for MD students, as well as the scientific researchers, the utilization of repertory is more essential even in acute conditions. So generally in repertory, we are free of prejudices. As I really feel, if a case has been repertorized and if I prescribe the remedy, I really feel I have a certain kind of confidence in myself that yes, this case is going to be treated by this remedy. So this confidence is generally being get is being get uh, I arrived to this confidence because of repertorization. Without repertorization, if I prescribe a remedy, I generally feel that this case, it may be cured or may not be cured. So this dilemma, it remains into my mind. So generally I feel that I just tell all the people that, of homeopathic fraternity, that utilization of repertory is very much essential in acute as well as chronic cases. Prescribing basis on grand totality, location, sensation, modalities, and concomitant can be done by the repertory. Eliminating the non-indicated remedies for the case can be also done with the repertory. So we will be dealing with the cases. Uh, Madam, whether the screen is been visible? Hello?
Yes, yes, yes.
Hello,
Screen
madam.
is
Yeah.
visible, visible.
Ah. Now I will be dealing with the cases of certain few. So this was more little bit theoretical. I do understand that many of our participants, they are practitioners, they are practicing, but the earlier slides were much were a little bit theoretical. But the background uh, has to be done, or it has to be addressed. So I just share my few slides with you, with all of you. So now this case of this was a case of mononeuropathy. So I'll be sharing 10 cases, and the later cases, in short, I have taken the case accurately. So let me tell you. So this case of mononeuropathy, a 73-year-old pain around the eyes, followed by drooping of one eyelid on the left side, as we say it as a ptosis. He has had this complaint since past 8 days. So he has this history of uncontrolled diabetes. So it was around 300 and HbA1c was 10.5%, due to which he ensured the symptoms of third cranial nerve mononeuropathy. And he was on the, even though he was on the anti-diabetic treatment, he was for long use of allopathic drugs. This condition was arrived in this case. But to speed up the cure, he was been suggested to he was advised to take the homeopathic treatment. So all the case taking procedures like preliminary data, past family, personal, physical journals, all those, to arrive to the acute totality, all the dealing with all those case history procedure. So the important, I will be sharing the important slides with you of this case, that the totality which I elicited was the affectation, that is, he was little bit pretended. He had got a desire for saw things. He was hurried by nature. He was having weakness. He was having walking aggravation. There was constipation. And as he was an old person, I have taken this rubric as a constipation of old people, falling of leads, falling of leads on left side, and paralysis of upper left lead. So this was the totality of the case. And taking this totality, the remedy which arrived was the alumina, which covered all the symptoms. And it also obtained the maximum number of the marks. It obtained maximum number of the marks. So I prescribed alumina 34 pills BID for 6 days and SL for 8 days. Along with that, I advise the patient for eating a healthy diet, regular physical activity, as well as exercise. Dietary counseling was also done. Later on in the next month, he got the symptoms of double vision. Then the potency was increased from 30 to 200. And 4 pills BID was been given. Later on, the improvement was started, and this was little bit improvement was seen in his eye. Then, considering the concomitant symptom of burning palms and sole, sulfur 200 stat dose was also prescribed. His left eye was now later on was completely opened. So after just he after the complete he was able to make the movement of the left eyelid, but that picture I couldn't be able to show you because he was taking the medicine. Later on the phone only, he just was very happy to share that the improvement was seen. So alumina was his acute remedy, and later on, I prescribed him sulfur 200. So like this case, it has made to the arrive to this condition that the mastery of a case taking repertorization is very much essential for such cases. successful application of the concept of individualization. General characteristic concomitants pointing to the deep acting constitutional remedy are best seen at the end of acute illness, which is being managed successfully with acute remedy. Knowledge regarding all branches of medical sciences will also help in the process of repertorization because we may get good number of nosological or clinical rubrics in the repertories, and if we are good or we are having the good command in the medicine, this diagnosis will help us. Now the next case as time is little fast. So the second case was a case of migraine. So a 45 years old female patient came with the history of severe headache, migraine, and backache. And after case taking and proper review of systems and repertorization, all was done. So all total history was taken. I was in a dilemma in for the prescription of the two remedies, that is Staphysagrine and Sulpulsitilla. So it made me whether to give Staphysagrine or Pulsatilla. I was not sure about which remedy has to be given because both these remedies they were they were covering all the symptoms and all the symptomatology was very matching perfect. I was not able to arrive at one. She stated that doctor there is, and really I felt that is certain from my breast at this age. Lactating, she was not a pregnant woman having this complaints, and it bothers. I never ever thought while Kane's repertory. Just I just the rubric repertory, book repertory, Pulsatilla Sagria. So here Pulsatilla it was also covering backache was also Pulsatilla, but this alone one single Pulsatilla has to be given. Obesity was there, and one more characteristic I found that that even though she was obese, she was aggravated from fanning. So this case was referred from nails repertory because all the remedies from all the means exhaustive repertories like synthesis I have prescribed, like sulfur, all the ratene, even the ratene I prescribed, but there was Naxomica, there was no relief. But while dealing with this nails repertory, I was teaching to the students the nails repertory. At the same time, the case had came hazard came for um, the hemorrhoids. There while I found this chapter stages of life and constitution, where size large obesity. So the one more characteristic was that obesity means the patient was very huge. So the obesity was more than I thought of. So such huge lady I've never ever seen till today. So that size large and obesity, that pointed me very well to prescribe the remedy capsicum. And the capsicum is the single remedy under this rubric. And really this capsicum helped her, and later on she had no any recurrence of the symptoms of the piles reported by the patient. So another case of injury, a 65 years old female patient with no significant medical history presented with the complaints of knee injury due to fall. So there was a pain and swelling of, and she was not able to move her the right knee due to pain. There was a little bit swelling in the middle and lateral aspects of the right knee joint. She was waking up at night because of the pain in knee. So the pains were very stitching, tearing, and worse by the motion. All the characteristic stitching pains they were aggravated by motion and night. So But the other, along with this, the other general characteristic mental symptom which was found in this patient was that she was, even though there was injury, she was not demanding any kind of help from others, and that was been revealed while history taking. She was really confined that no, nothing, no, I am not getting help from any. I don't like to take the help from others. So that was the thing which was a characteristic in that patient. So I took the rubric ask for nothing under from the mind section, and desire to be alone. She was having that symptom characteristic of mind symptom, and extremities injuries joints, extremities pain knee motion, generalities rest ameliorate. So considering all these totality, the remedy which covered all these symptom was Brinia, and Brinia 200 BID for 3 days really helped her in reducing the complaints. So generally we see that the patient is irritable. The Brinia patient is much more irritable. But the thing which I found in this case was the rubric asked for nothing, and in that really made me to think of this remedy Brinia. So patient was also advised to take rest. So this Brinia 200 helped in reducing her complaints of pain. So there was another case of dysmenorrhea where there was pain in abdomen during menses, and one more characteristic was that the menses they were last for longer time. That was what we can see, that is protracted. Too long menses are the protracted menses, and there was one a concomitant symptom like acidity and constipation. So in many acute conditions, the concomitant symptom they help us to arrive to the correct remedy. So this case was referred from the or repertorized from Fatak's repertory. Here, complaints of dysmenorrhea and constipation was relieved by the Nux vomica. So 30 TID was given for 4 days, and later on she has had no any complaints of pain in abdomen during menses. So here. While dealing with the acute conditions, the concomitants also do matter in pointing towards the right remedy. Another case of pharyngitis where there were characteristic symptoms of the along with the throat pain and the cough and weakness. The patient has a characteristic symptoms of mental symptoms like she was despair, weary of life. Then rest when things are not in a proper place, cannot rest, like fastidious type of patient was there. So even in any kind of conditions, it may be the acute conditions, and if we see these mental symptoms which are leading like fastidiousness, we come across to the two remedies like arsenic album and Nux vomica, where the two cases they are more prominent in Kane's repertory. So these mental conditions also help us in arriving towards the true simillimum along with the particular uh, symptoms. So in this case, arsenic album 30 potency 4 hourly was being given to the patient because as this was a case of a fever, I really felt that the repetition has to be given, and it really helped the patient. Arsenic album 30th potency really helped in getting the complaints of throat pain reduced. So this case help us to know that ki baba, along with the location sensation modalities or concomitants, the mental symptoms also do help in selecting the medicine. Now, another case we can see, we can now go through the acute exacerbation of chronic diseases. There are various cases. Here, the acute exacerbation of chronic state should not be missed for acute illness. It is recommended that, as far as possible, selection of acute remedy should be based on the acute symptomatology, as we have seen earlier. And later on, we can manage the case by utilizing the constitutional remedy. So we should go up with managing the present problem first with the acute remedy and later on followed by the constitutional or intercurrent remedy. So this chronic case of psoriasis was there, but the acute complaint was severe itching on the case of psoriasis over both the upper extremities and lower extremities. All the remedies they were tried. All the remedies they were tried. Um, Borix repertory I have utilized, but even arsenic I prescribed the patient not felt so much uh, emulated with the arsenic album. Then many a times we come across with the rubrics and the remedies, but our selection go towards the remedies which have been regularly been utilized. But here repertory is one of usefulness of repertory, that is we it helps to decide, or it helps to prescribe the remedy which we have never ever thought of. So while studying the matramedic of all those remedies, I came across to the borax. So borax, I really found that how borax can be utilized for the psoriasis. Let us see, because we tried every remedy, that is arsenic, ars iode, graphites was given, even sulfur was given in earlier cases. And as there was severe itching, I thought that the acute remedy has to be prescribed in this case. And to my surprise, borax was a very good remedy for this case, and it helped this remedy. And this case was being helped by the borax repertory. So one should also think of borax remedy whenever the case of psoriasis comes up with the acute exacerbation. Same thing, a case of rheumatoid arthritis. She was a lady. She was having all the types of small as well as large joints deformity, having a known case of rheumatoid arthritis. One day she came and she was taking the treatment for rheumatoid arthritis for me, as I prescribed her as Brina. After even calcarea, uh, fluor was also being prescribed. And but now she came as she was a chronic patient to me. She came with for the acute her for her acute complaints. And she was having choleolethasis. She revealed that while doing the sonography, I came across with this disease like choleolethasis along with the rheumatoid arthritis. Then, considering the choleolethasis, because the acute totality has to be treated first, so considering that, I prescribed Barbaris vulgaris from Borix repertory, that is abdomen, gallbladder, biliary calculi, choleolysis. So the thing to mention here is that Barbaris vulgaris 200 not only helped her complaints of gallstones, but she revealed that you have never ever given such good remedy before, because this remedy not only helped my pain in abdomen, but it helped my rheumatic conditions. So Barbaris vulgaris can be thought of when a case of rheumatoid arthritis is there along with the choleolethasis condition. So this Barbaris helped her dramatically, and not only her trouble of acute complaints of gallstones was relieved, but her rheumatic affections was also been relieved. So many times one single remedy, it helps in acute condition as well as for her chronic conditions. Another case, this case I have shown the picture. This case has been published in a journal where before and after treatment pictures are there, but now I am unable to show. This was a case of a chalazion where a recurrent chalazion was there, and 2 to 3 times she has undergone with the surgery, and but even though the surgeries have been done, she was having she once again she came with the complaints of uh, this nodule over her lower eyelid. And this chalazion was a painless swelling of the lower eyelid that appears due to blockage of um, oil or mammalian gland. So by referring the synthesis repertory from computer software radar, eye chalazion tumor lead nodule staphysagria, which was the first grade remedy, and tremendously this case was being cured. And not only the case was being cured, but the predisposition of getting recurrency of the appearance of this chalazion was being relieved by this remedy staphysagria. Another case of influenza
Yeah,
was there,
Dr.
a fever with
Aarti,
pain of.
sorry to interrupt.
Huh.
You have only 6 minutes left. Yeah, you can
Yes,
continue.
yes,
You have 6 minutes more.
yes,
Yeah,
yes. Only last. Yes, yes. Only
yeah,
last slide. Yes.
yeah. Sure, sure.
Last
Take your
case.
time.
Yeah.
I was just informing you it's 6 minutes left.
Yes, yes. Thank you. Just I also went to the time only. Yes, this was a case of influenza where fever was there, cold and coryza, influenza-like symptom was there. Here, the repertory used was a Murphy's repertory, and one Eupatrium 200 TID was given for the 4 days. And not only the cold and coryza helped, but even the weakness of the and severe bony pains, they also it also been helped by for this case. So one more epidemic diseases. I have also cured many epidemic diseases because as uh, uh, we have always said that that homeopathy acts well in epidemic diseases. So by close observation of several cases of every such collective disease, we get the totality. And so The history taking in the epidemic disease is little bit different, where the many of the patients symptoms have been has to be collected, and one genus epidemicus has to be arrived for. So case taking, totality, repertorization, so these are the different steps. And arsenic album, as we all of us know that before pandemic epidemic for COVID-19, arsenic album was given. Another, in our hospital we have prescribed argentum nitricum 200 was being utilized as a genus epidemicus in conjunctivitis. I have also treated the FMD diseases of buffaloes and bulls in the barn, that is foot, mouth, and diseases by Merxol 30. So as we have got villages, small villages, and many of the cattles they are there. So 3 years before, there was an epidemic of foot, mouth, and FMD disease, that is foot, mouth disease of buffaloes, and we had a bull barn in our nearby city, and there the foot, mouth disease was being prevailing. Even in those barn, this Merxol was given. So first I studied this foot and mouth disease, and the symptoms of the FMD they matched with the Merxol. So this Merxol really helped, and I prescribed many of the dairy owners this Merxol I was prescribing, and really that helped. For 1 month I prescribed this medicine, because after knowing that yes, this medicine is very effective, they took the help of homeopathic medicine Merxol, and they used to come to the OPD, and they used to take the medicine. So really, as the earlier speaker,
Yes,
sir has also told that utility of the homeopathy in veterinary. So it's really good. Even in epidemic diseases, also homeopathic medicines
yes,
works. And as epidemic disease
yes,
comes
madam.
in
Our
acute.
time is about to finish. We can have a
Yes, yes,
second part of the same so that you can face more cases.
yes, yes. So the last slide. So acute case provide a homeopath with an opportunity to provide the efficacy of the system. Repertorization is must for prescribing scientifically in acute case, and homeopath should be knowledgeable and unprejudiced while selecting a repertory rubrics. And repertory is a tool that can fix the most difficult acute cases, provided it is been artistically and skillfully. So one should always use repertory to arrive towards the homeopathic practice, which makes our homeopathic practice easy. So once again, I'm thankful uh, for Sahani sir and for all the participants for listening me and giving me an opportunity
Yeah.
to share my views.
Yeah, a wonderful session by Dr. Aarti. She presented a large, many amount of cases here, around 10 to 11 cases about acute diseases and how we can repertorize and treat our acute diseases in our clinics. So it was a very wonderful session, ma'am. You're getting a lot of
Thank you.
appreciation. Also, Dr. Beatrix Gasner, and everybody is appreciating you in the chat box. You can see. Yeah,
Okay.
and yeah, and
Thank you. Thank you.
yeah, any also inputs from Dr. Gesner, please.
Yes, thank you very much for the really very, very nice and practical
Thank
session.
you.
And I really loved this session. I think my colleagues also, because we are in the front having our patients want to treat well. And I totally agree. We have to be very, very good in the treatment of acute diseases. This makes the confidence for the patients. Thank you very much.
Thank you. Thank you.
So I would like Dr. Dinesh, so you
Yes,
can conclude the session, sir.
yes.
Thank you. Yes.
Thank you, Dr. Aarti S. Kognole. It's really a very good session. It would have been better if you present 5 cases now and then 5 cases in the coming edition so that people could understand it in a better way, because you are just
Oh,
going like a 2020 game here and so much of
okay.
fast. So
Oh,
better in the coming edition of your presentation, you may limit the cases and so that we can have a
okay.
better discussion. Actually, we need a 10 to 15 minutes discussion so that
Mhm.
those who can clear their doubt, as well as they can comment on the presentation, as well as anything and everything. Anyway, congratulations once again, Dr. Aarti, as well as Dr. Mehakaka, for beautiful uh, moderation of this session, and those who participate in the session also. On behalf of IFPH as well as on my behalf, thanking you all. Thank you all.
Yeah, thank you.
Thank you. Thank you, sir. Thank you. Thank you.
Congratulations, Dr. Aarti. Yeah, amazing
Thank
session.
you. Thank you. Thank you.